Quadriceps are a group of four muscles on the anterior of the thigh or upper leg. The rectus femoris is the largest of the four and has its origin in the anterior inferior iliac spine, or AIIS, and its insertion in the tibial tuberosity via the patellar tendon. It is the only quadricep muscle that crosses both the hip joint and the knee joint, so it acts on both of those joints. The vastus lateralis, vastus intermedius, and vastus medialis all have their origin in the femur, and like the rectus femoris, have their insertion on the tibial tuberosity via the patellar tendon. So kind of like in the lower leg, how we saw the gastrocnemius, soleus, and plantaris all merged together into a common tendon and had a common insertion point, all four of the quadricep muscles merge into a single tendon and go through the patella, or the patella is basically embedded in that tendon, and then have their insertion on the tibial tuberosity. All three of the vastus muscles work to extend the knee, which the rectus femoris did as well, but because the vastus muscles do not cross the hip joint, they only have an effect on the knee, so their only action is extension of the knee. And Salifit makes the claim that the lateral or the vastus lateralis might have a slight effect on outward rotation, and the vastus medialis might be able to have a little bit of an effect on inward rotation at the knee joint. But if we remember from the anatomy of the knee can only have a little bit of rotation in a flexed position. So if the knee is in a flexed position, then maybe the vastus lateralis can have a little bit of external rotation effect, and the vastus medialis can cause a little bit of inward rotation.